Kidney stones, in simple terms, are formed because of an imbalance between electrolytes and other substances such as oxalate in the kidneys and the water content. If one is dehydrated, for instance, these crystals can form and increase in size as time goes on. Kidney stones that do not block the flow of urine and are sitting dormant inside of the kidney typically do not cause pain. However, as soon as the kidney stones block the flow of urine and are trapped somewhere along the urinary system and cause back pressure and dilation into the kidney, then excruciating amounts of pain can develop. If an infection is superimposed on top of this, then a patient can become septic very quickly, and this poses a surgical emergency.